1. A 55-year-old man with a history of poorly controlled hypertension presents with a history of sudden onset central chest pain. There are no diagnostic electrocardiogram ECG abnormalities, and an interval troponin concentration is not diagnostic of myocardial infarction. What diagnosis should be confirmed or excluded next? The answer is B. Aortic dissection. In a patient with poorly controlled hypertension, aortic dissection should be considered as a potential cause of acute chest pain. While interscapular pain is a common feature of acute aortic dissection, the presentation is highly variable and central chest pain commonly occurs. If antiplatelet or antithrombotic drugs are given before excluding this diagnosis, fatal bleeding may occur. 2. The term orthopnea refers to breathlessness dyspnoea in a particular situation. Which answer below describes that situation? The answer is C. Immediately on lying flat. Orthopnea refers to breathlessness occurring immediately on lying flat, whereas the term paroxysmal nocturnal dyspnoea refers to sudden episodes of breathlessness occurring at night time. It can occur with respiratory pathologies such as chronic obstructive pulmonary disease, but is most often associated with heart failure. It is caused by gravity-dependent changes in pulmonary capillary hydraulic pressure leading to alveolar oedema. 3. A 75-year-old woman presents to her family physician with a 24-hour history of rapid, irregular palpitations accompanied by fatigue. In an elderly patient, what is the most likely cause of palpitations? The answer is B. Atrial fibrillation. The most common cause of a rapid, irregular rhythm in the elderly is atrial fibrillation. In patients with very frequent trial or ventricular ectopic beats, the pulse is also very irregular, but a regular pattern can usually be perceived within it. 4. A 74-year-old woman presents with breathlessness. She is found to have an elevated jugular venous pressure (JVP). Which of the following conditions is most likely to explain this physical finding? The answer is E. Recurrent pulmonary embolism. The internal jugular vein is in direct continuity with the right atrium, and there is no venous valve between the two. The JVP therefore is a reflection of right atrial pressure, which becomes elevated in conditions where either there is increased resistance to right ventricular ejection, e.g. pulmonary hypertension due to chronic lung disease, or recurrent pulmonary embolism or mechanical dysfunction of the right heart, e.g. right ventricular infarction, right-sided valve disease. 5. A 56-year-old man presents with a history of headache. He is noted to have a loud second heart sound on auscultation. Which of the following pathologies could explain this finding? The answer is B. Essential hypertension. The second heart sound, which occurs at the beginning of ventricular diastole, occurs when the aortic and pulmonary valves close. When either aortic or pulmonary artery diastolic pressure is high, e.g. in essential or pulmonary hypertension, the second heart sound may be loud. Postural hypertension will have little effect on the intensity of heart sounds at rest. Aortic incompetence is often associated with a quiet second heart sound, and mitral incompetence with a quiet or absent first heart sound. A mechanical mitral valve replacement will produce a loud mechanical first heart sound. Subscribe the channel and share this video with someone who always loses challenges.